Treatment of oral submucous fibrosis. Basically, oral submucous fibrosis cases you can divide into three parts: mild, moderate, and severe. Other ways you can diagnose the severity of disease by keeping the finger. If the three fingers are going between the interincisally in maxilla and mandible, then you can say it's a initial case of oral submucous fibrosis. If only two fingers are going, then it's a moderate case of oral submucous fibrosis. And if the only one finger is going, then it's a severe case of oral submucous fibrosis. Right now, how to plan the treatment? Right, in a initial case of oral submucous fibrosis, where only three fingers are going, where you can give you can advise a cessation of the habits, tobacco. Then you can advise some antioxidant. You can advise some multivitamins, B complex and vitamin C, and you can tell patients to do a oral mouth opening and closing physiotherapy treatment. Right, moderate case of oral submucous fibrosis where only two fingers are going. Here, patients sometimes give symptoms where they can develop a burning sensation while eating a spicy food and a hard food, and obviously you have to tell that you have to stop the habits. And you can give a antioxidant orally. Injectable corticosteroid, placentrix injections are also helpful. Then in a severe case of oral submucous fibrosis, obviously the treatment of choice is surgery, where you have to do a intraoral fiber excision of the bands, then interpositioning of buccal fat pad or nasobuccal graft, where you have to take the skin from the face and you have to put inside intraorally by tunneling. This procedure should be done under the general anesthesia. Here you have to do a coronarectomy also. Post-operative you have to do a aggressive physiotherapy, where you have to tell patients to use a Hister's jaw stretcher and mouth opening and closing exercise for a minimum 2 to 3 months. But after all this treatment, if patient is continuing with the habits, there is a no results patient is getting. So stoppage of habit is a very important key. Right, so this is a brief idea of treatment of oral submucous fibrosis. Hope it will help. Dr. Hemant Bhavnerkar, oral and maxillofacial surgeon, Mumbai.